Bismillahirrahmanirrahim. We are looking at the premature rupture of the amniotic membrane. Okay, so if you look at the picture, so this is the fetus, and here is the amniotic cavity, and the fetus is surrounded by the amniotic fluid. And in this picture, you can also see. So during the labor, when the cervical dilation reaches 8 centimeter, there is a normal rupture of membrane. Sometimes we also give the artificial rupture of membrane, mean the nurse itself they rupture this membrane when the cervical dilation reaches at 4 centimeter. So this is normal. So why this is important? Because there is a high level of prostaglandin in the amniotic fluid, which further increase the cervix dilation. So this is normal in the normal physiology, but if it's occur before the labor, so this is known as premature rupture of membrane. So the rupture of membrane occur before the labor onset, but after the 37 weeks of gestational age, we call it the premature rupture of membrane PROM. Okay. There is other term which is PROM, mean it's a pre-term pre-rupture of membrane, mean there is a rupture of membrane before the 37 weeks. After 37 weeks, it's a PROM, mean a premature rupture of membrane, but if before the 37 weeks, it's a pre-term. Okay, so between you can say the 20 to 37 weeks. The other term is EPROM, mean early premature rupture of membrane, but it's during the labor, but before the cervical dilation reaches the 8 centimeters. So this is known as the early PROM, mean during the first stage of labor. Okay, so because in the first stage there is a cervical dilation, but when they reaches the 8 centimeter, it's a rupture. But if it occurs before that, so that is known as early PROM. Okay. And how the patient, how the pregnant woman present. So there is sudden gush of water fluid per vagina. Sometimes the patient may confuse with the urine. So the simple, the most common presentation is the wetting of the female pad. Okay, so they consider it's a urine, but it's the amniotic fluid. Okay, how you confirm it's the amniotic fluid or it's a urine? There is certain tests. Number one is a nitrogen paper test. This is nitrogen the test which actually become blue when it's if it's amniotic fluid. Okay, so this is the actually the test. If in this bluish color represent there is a rupture membrane, because this is a because it's a alkaline, okay, which actually turn the paper blue. Okay, there is other test. So you can see the microscopic picture of the amniotic fluid. Okay, and the latest test, which is amnisure test, which actually check out the placental alpha microglobulin 1. So this is test which the latest test is confirm the amniotic fluid. Okay, so these are different tests: nitrogen test, permanent test, amnisure test. Okay, so you must remember these terms and the presentation: sudden gush of water fluid per vagina. Okay, okay, so you must remember these terms. And the presentation. What is the important symptom? That is a sudden gush of water fluid per vagina. Okay, so what is the etiology? Etiology is mostly idiopathic, sometimes due to infection, especially bacterial vaginosis. And if its intrauterine pressure is increased, it may rupture the membrane, or sometimes due to trauma, or if the cervix is incompetent. So when there is enlargement, so this causes a rupture of membrane, or sometimes due to male presentation of the fetus. So these are different etiologies which can cause a rupture of premature rupture of membrane. Okay. So, what examination you should perform when this presentation? So, first of all, you look at the abdominal examination, where you take out the fundal level. So, these are different fundal level by the increasing the gestational age. So, there is the the fundal level is going up and up, and at the 40 weeks, at 37 weeks. So, but if this rupture occur, premature rupture occur, so the fundus go back to the amenorrhea level. Okay, so which is less than the amenorrhea period. Okay, and you can also easily palpate the fundal parts because there is no amniotic fluid present in the amniotic cavity, so you can easily palpate the fundal parts. Okay, if there is tenderness in the uterus, so this suggests the chorioamnionitis, mean there is an infection in the amniotic fluid. Okay, what are local examinations you can perform? There is inspection of the fluid leak through the vagina. There would be a seminal order. Okay, and you go for the palpation or a digital examination of this finger. Okay, so and then if you go for the fluid examination of the finger, it suggests the amniotic fluid. Okay, and then also you can check out the through speculum. There is a fluid pooling in the the posterior cervix or fornix. Okay, so you can check out this. So if there is fluid pooling in the posterior fornix, so this suggests the premature rupture of membrane. Okay. So what are investigation? As I mentioned, nitrogen paper test, Ferning test, Premature, or you can alpha fetal protein of this fluid suggests the amniotic fluid. Okay, so and you can check out the ultrasound. Go for the ultrasound to check out the amniotic fluid index. If it's less than 5, mean it's oligohydramnion because the fluid is lost through the vagina. So this confirm the diagnosis. Okay. So what are complications of the premature rupture of the membrane? So there is some maternal and there are some fetal. Maternal, there would chances increase the risk of infection and puerperal sepsis and chorioamnionitis. So these are most common side effect, the complication. And what are fetal? There would be a prematurity which can affect the lung development, GIT development, and there would be a premature placental separation and increase the risk of infection like pneumonia, meningitis, and the compression fetal syndrome, cord prolapse, malpresentation. So these are complications of premature rupture of membrane. Detect the complication, especially infection. How you can check out the infection by looking at the CRP, mean C-reactive protein, total leukocyte count, or differential leukocyte count, ESR, erythrocyte segmentation rate. So this define the inflammation is present or not. Okay, so and in the management is antibiotic. So then second thing, you should check out whether you should start the follow up or terminate the pregnancy depending upon the condition. Three condition. Okay, if the gestational age is less than 36 week, no mother fetus complication, no uterine contraction, then you continue the follow up of the mother to check out, assess the mother and fetus condition. If the age is more than 36 week, gestational age is more than 36 week, or there is a mother fetus complication or uterine contraction started, then you should terminate the pregnancy. Then assess the condition whether it is ideal for the vaginal delivery or for the cesarean section. Okay, but do not give the tocolysis because tocolysis means when you delay the pregnancy. Okay, do not delay the pregnancy, and also avoid the digital cervical examination because this increase the risk of infection. Okay, thank you.